Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at the hand, and to get started, let's actually review a little bit about its compartments. So, if you look closely, we have the hand, which is going to have superficial, intermediate, and deep portions, and then even a little bit along the posterior or dorsal portions as well. But the compartments will include a few major kind of regions. So, to start off with, if you look at your own hand, you might see that there are a couple of bulging regions. This right here and this right here have names which are called the thenar or hypothenar region, which is going to be mostly respective to either the thumb or the little finger. And then in the middle, we have what's called the central compartment. And then we have a little bit of a specialized compartment with a singular muscle called the adductor compartment. And then between the bones, we have inter, meaning between, and then bones being osteo or osseo. These are called the interosseous region or compartment. So, to get started, let's actually look at some pretty superficial structures along the hand. So, if you look closely, there is this large piece of connective tissue that is on the front of the hand. This is called the palmar aponeurosis. So, palmar meaning palm, aponeurosis meaning like a broad connective tissue. And this is actually a pretty significant piece, which is going to be covering the majority of the palm and helping to protect a lot of its internal structures. But if you look closely, there's also a tendon and two muscles connecting to it. So down here, this is where you have what's called the palmaris longus. So if you remember, there's a muscle that goes right down the palm through or connecting to the flexor retinaculum and into the palmar aponeurosis. This is the palmaris longus. And then over here, if you have a palmaris longus, you typically have a palmaris brevis in this case. So palmaris longus is a weak flexor, and this is a muscle that not everyone has, but if you see that singular tendon traveling through, then that is likely indicating that you have a palmaris longus. But if you're one of the 12% that don't worry. I mean, it doesn't do a whole lot. You have plenty of other muscles to help with flexing your wrist instead. But even smaller, you have the palmaris brevis, which is going to be connecting along the medial side of the palmar aponeurosis, and it's just going to go to the skin along the medial side of the hand. So it actually doesn't do a whole lot. It just kind of helps with wrinkling the medial side of your skin over on your hypothenar region, but it's a pretty small muscle and it's very superficial, so it's kind of hard to see sometimes. But another thing that I want to bring up while we're here with some superficial structures is this thick band that runs over the front of the wrist called the flexor retinaculum. So, the flexor retinaculum is going to be a band of connective tissue that covers the front of the wrist, and it helps to form this, tunnel called the carpal tunnel. And through the carpal tunnel, you're going to have a few major things. So if you look closely, you're going to have 9 tendons, which will be belonging to 4 of which from flexor digitorum superficialis, 4 of which to flexor digitorum profundus, and then 1 of which to flexor pollicis longus. So all of those tendons going into the hand to the fingers, digits 2 through 5 for digitorum, and then pollicis for number 1, all of those go through the carpal tunnel, along with a singular but also very important and large nerve, which is the median nerve. Now, while we're talking about the median nerve, we can actually follow that a little bit. And if you look closely, it's going to go all the way to the front of the hand and also to specific fingers, which will be sensory to the lateral 3.5 digits. So 1, 2, 3, and then a half. So if you look at median nerve, this is only going to go to this side of your ring finger. So median nerve. This is going to go to the skin over here, but also remember, it innervates a lot of those muscles in your flexor compartment of your forearm. Now there's one more branch, and although not super visible on this model, there's a little branch that's going to be coming off of median nerve and going actually backwards into the thenar region. So when things go backwards, we have a term to use for that, which is called recurrent. So the recurrent branch of the median nerve will go off and into the thenar region, traveling slightly back up into, towards the wrist. So with that said, though, we have other nerves and blood vessels to look at, but we'll look at those a little later. But let's take a look at our muscles first. So to continue off of our different compartments, we have the thenar and hypothenar regions. So the thenar region is mostly going to be relative to the thumb or the pollex, and then the hypothenar region is mostly going to be relative to the pinky, the little finger, the fifth finger, or what we're going to be saying is digiti minimi. So if you look closely, we have a few muscles on each side, and luckily the organization is going to be relatively similar. So let's go ahead and start off with the thumb side. So when we look at the thumb, remember the term that we'll use is the word pollex. So in this case, we have this lateral muscle along the side of the thumb, and this helps to pull the thumb outward and away from the midline of the hand, the midline being down the middle finger. So if it goes away from the midline, this is called abduction. So what we're going to call this muscle is abductor pollicis and then brevis. So I know that's a little bit of a specific name because we haven't really talked too much about the longus, but if you go back to looking at the forearm, we'll see that there's actually an abductor pollicis longus as well. So abductor pollicis brevis is going to be this muscle along the lateral side of the thumb or lateral side of the thenar region. And then right next to it, this one is going to be called the flexor pollicis brevis. Now, this is one that we do know, which is going to be going through the carpal tunnel, the flexor pollicis longus, and this is going to be flexor pollicis brevis. Now, there is one more muscle that's a little bit different from those two, and that is going to be shown a little bit along the side, but mostly underneath. This is called the opponens pollicis. So the opponens pollicis, it's a little bit hard to see because it's generally underneath the abductor for the most part, but if you look carefully, sometimes you can see it poking out, but you can also kind of separate these two muscles to see it as well. But opponens basically means that the thumb and the pinky will kind of go towards each other to oppose each other, and this is going to require a little bit of flexion, but also a little bit of rotation. So the pinky is going to have the same thing to help doing that on the other side, which let's go ahead and take a look at those as well. So the thenar region was relative to the thumb. The hypothenar region will be relative to the pinky. And remember, the pinky is going to have a specific word for that or phrase, which is digiti minimi, the little finger, the small digit, the minimal digit. So this is going to be digiti minimi, and just like before, going away from the midline, this way. This muscle on the side is called abductor digiti minimi. And then in a similar manner, right next to it, you have flexor digiti minimi. And then one last one, similar to before, underneath the flexor, you also have opponens digiti minimi. So luckily, you know exactly the same thing between pollicis and digiti minimi. Just make sure that you're looking at the wrong or the right side and you have that organization down, but that's the thenar and hypothenar compartments. Now, before I get into the central compartment, I do want to show you one more muscle that is kind of important for the thumb as well, which is right, or not on the lateral side, but on the medial side of the thumb. And this is going to be able to pull the thumb inward, which is not abduction, but adduction. So in this case, instead of being abductor, this is called adductor pollicis. So adductor pollicis with two D's, D as in dog. This is two heads though, transverse head, and then also the oblique head. So that's the singular muscle in the adductor compartment. But let's go ahead and see what we have here in the central compartment. So one thing that you might notice is that you have these large bands traveling through here. These are the tendons of the flexor digitorum superficialis and profundus. So if you look closely, like really closely, there are these two bands that kind of bifurcate right here, or the singular band that bifurcates right here. This is the flexor digitorum superficialis, and then you have the tendon traveling through to the distal phalanx. This is the flexor digitorum profundus. So an important thing about, those two muscles, flexor digitorum superficialis only flexes up to the PIP, or proximal interphalangeal joint, but the flexor digitorum profundus will flex all the way to the distal phalanx at the distal interphalangeal joint. Now, with those tendons in mind, if you look at the central compartment, you might note that there are these muscles actually right between them. These muscles that are right in between them are called lumbricals. And these tendons are actually going to be connecting from the tendons, which are the flexor and or the superficialis and the profundus, but then they will go to the fingers to help with bending them at the middle or the metacarpal joint, and then also helping to extend the fingers as well. So it bends at the metacarpal phalangeal joint, or MCP, and then it also helps with extending the fingers as well. So that would be the central compartment. And to finish off muscles before we look at the blood vessels, you can also see that you have some muscles between the bones as well. Now, to be honest, these are a little bit hard to differentiate, but what you'll see is that you'll have muscles on the palmar side as well as along the dorsal side. So you can see them. It's just hard to kind of know which one's which, but these would be the palmar interossei, and these are going to be helping with adduction. So these help to adduct the fingers like this. And then you'll also have the dorsal interossei, which are going to be on the back of the hand over here, that help with abduction. So abduction, which is bringing the fingers out and separating. So with those in mind, that's basically the majority of the muscles like on the hand itself. But let's actually look at some other things real quickly, which include some arteries and nerves. So first of all, if you look at the wrist region, you'll be able to see that you have these two red blood vessels. These are going to be arteries either on the radial or ulnar side. And if you can guess, these would be the radial and ulnar arteries. Now, from both of them, though, you're going to have these branches which are going to go to these arches along the palm, and those will either be the superficial or deep palmar arches. And name for them, you'll either have the superficial or deep palmar branches. So the radial artery in this case, this is the one that you would typically take your pulse from. You can see that there are two branches, one that's going superficially, one that's going deep. And then the ulnar side, although you can see the superficial one, the deep one's a little harder to see, but you can see that right here as well. So if you look closely though, these two superficial branches will connect right over here along the superficial region of the palm, right underneath the palmar aponeurosis. This is the superficial palmar arch, which then leads to common digital branches, and then finally leads to proper digital branches in the fingers. And then if you look underneath the central compartment, you'll see the same thing, but harder to follow. You have two dorsal branches coming from, or two deep branches coming from the radial and ulnar arteries. This is going to lead to the deep palmar branch instead. Now there's one more nerve to look at, really, or actually two more nerves to look at. But if you look closely, you have this nerve on the medial side of the hand, which if you remember on the medial side of the forearm, that's the ulnar side, and this is the ulnar nerve, which if you remember from our cutaneous our sensory innervations, the ulnar nerve goes to the medial 1.5 digits, which you can see it branching to go to here and here along the anterior, but also the posterior side. Now to look at the posterior side just a little bit, you can also see the radial nerve, which is going to have a superficial branch as well, and this is going to go to the lateral 3.5 digits on the posterior side of the hand. So 1, 2, 3, and then a half. Now to get a little bit specific, if you look closely, there's also a bunch of tendons connecting to here as well, besides just the the flexor digitorum, superficialis, and profundus. So if you try to remember those muscles along the the flexor side of the forearm as well as the extensor side of the forearm, you might be able to see some of those. So if they don't go to the fingers, if they just go to the hand, they're mostly going to be carpi. So in this case, you have flexor carpi radialis, flexor carpi ulnaris. So going to the metacarpals over here, and then going to metacarpal 5 as well as some of the carpal bones. But then on the other side, this is a little bit more specific, but this is where you'll have extensor carpi radialis longus and brevis, and then extensor carpi ulnaris. But lastly, if you look over here, do you remember how you had abductor pollicis brevis? You also have an abductor pollicis longus, and then two more muscles going to the pollex, but we talked about the flexors, but you also have extensor pollicis brevis and extensor pollicis longus, and this is also where you form something called the anatomical snuff box. And this is where you should see a branch of the radial artery, as well as potentially, although not shown on this model that well, a little bit of the superficial branch of the radial nerve. So I know that the hand gets a little bit tricky, but luckily the compartments actually do have some organization which is kind of similar to each other, especially the thenar and hypothenar regions, and then dorsal and palmar interossei, but the lumbricals, they're a little bit different from what we've seen, but try to organize it into the compartments, try to organize it into layers, and just make sure that you try to keep track of how you look at the muscles, and it's not as bad as it seems. So I think with that said, that should be just about it for today. So good luck with your studying. Thank you for listening, and I'll see you all next time.